Now let me see about the kidney 3 point is located on the midway between the tip of the medial malleolus. This is the medial malleolus. We try to understand this is the tip. So this region is the tip of the medial malleolus. Then this tendon to be known as the Achilles tendon or the calcaneal tendon. Anterior border of the calcaneal tendon and the tip of the medial malleolus. In between the depression, the kidney 3 point is located. Make sure, because on the K3 point, importantly, there is a posterior tibial vein, posterior tibial artery, and then posterior tibial nerve. There are the 3 vessels are existing in this particular region. So we try to find out, once you place on midway between these two, you just feel it, there is a artery is getting the palpation. You can have a look how there is the impulses is happening exactly on this region. This muscles called as a flexor hallucis longus muscles. On the anterior to this muscles, there is a posterior tibial artery, vein and a nerve is existing in this region. Whenever we puncture this needle on this specific region, we shouldn't touch to that nerve and also to the artery. So now let me see where precisely this point is located. So I am using the nearly 1.52 needle on the kidney 3 region. I know there is a palpation is here, but kidney 3 point is located posterior to that region. That means now K3 I applied the needle. Anterior to the kidney 3 point, there is a posterior tibial artery, vein and nerve is existing. So therefore we should apply to the posterior to that nerve, which is most crucial and imperative to treat for the most of the renal and kidney related disorders. So here you can remember as the टैक्सी को याद रखते हैं तो आप किसको याद रखते हैं? K3 तो आप इतना प्यार करना है उसको, इतना प्यार करना है, हर एक दिन आपको एक्टिवेट करना है इस पॉइंट को, ठीक है? आप जानते हो आज सुबह में मैं भी एक्टिवेट पढ़ रहा था तो मैं खुद भी एक्टिवेट कर लूँ बोनस फ्री, जब मैं पढ़ता हूँ तो एक्टिवेट कर लेता हूँ। कोई इंपॉर्टेंट पॉइंट होता है भाई, मुझे भी एक स्टामिना एनर्जी हो जाए तो मैं भी एक्टिवेट कर लेता हूँ. बट हाउएवर लेट मी सी नाउ द पॉइंट टू बी नोन एज ए थाई ची, राइट? नहीं तो ಟ್ಯಾಕ್ಸಿ याद रखेंगे. ಇಟ್ ಈಸ್ ಸೂಪರ್ ಸಿಂಪಲ್. ಅರ್ಥ ಆಗುತ್ತೆ ನಮ್ಮ ಮನಸ್ಸಲ್ಲಿ ಮಡಗ್ತೀರಾ, ನಿದ್ದೆಯಲ್ಲಿ ಕೇಳಿದ್ರೆ ಹೇಳ್ತೀರಾ ನೀವು ಟ್ಯಾಕ್ಸಿ ಅಂದ್ರೆ ಏನು? K3 ಅನ್ನೋದು ಅರ್ಥ ಆಗುತ್ತಾ? K3 ನೀವು ನಿಮ್ಮ ಹಸ್ಬೆಂಡ್ಗೂ ಹಾಕಬೇಕು, ನೀವು ಹಾಕೊಂತೀರಾ? ಸರಿ, now let me see where this location is located. Midway between in the depression on the tip of the medial malleolus and also anterior border of the Achilles tendon. Achilles tendon also to be known as a Achilles tendon or the calcaneal tendon as well. This tendon to be known as the Achilles tendon, calcaneal tendon. There are the, however you can pronounce same. But now let me see this to be known as a now medial side, tip of the medial malleolus. The tip of the medial malleolus because very imperative to understand the location. Sometimes you does a mistake where exactly this point is located. Now you keep it in the mind. One is the midway between the tip of the medial malleolus and then anterior border of the Achilles tendon. In the depression this point is located. Okay, you are applying that particular point. Perhaps sometimes you may not, if the obesity patients are there, but you cannot find out exactly where is the tip, where is the medial border of the Achilles tendon. But however, in the center you are applying the needle. But emaciated body, very thin body like me, you wanted to place the needle. I am thin person, by the way. You just look into that where exactly there is the muscles called as the flexor hallucis digitoris muscles. The flexor digitorum longus. You keep it, flexor digitorum longus muscles are there, and on that muscles this point is located. But anterior to that particular point to be known as a posterior tibial artery is existing. That the posterior tibial artery puncture to that region, then your patient feels some kind of the pathetic pain, and also that's not good sign. But you just palpate on that region, try to find out. Even all of you can find that perhaps in the Zoom people who are sitting in the cross legs, try to find out where is the K3 point anterior to that region. That artery is there. That artery, keep it in the mind, that artery name to be known as a posterior means is the back. Tibial artery, tibia means is the shin bone. So tibial artery, so that artery to be known as a posterior tibial artery, that palpate that artery and then puncture beside of that is advisable in generally. But the beauty of this particular point, the K3 point is the grandmother point to be known as a K3. The K2 is the grandson point, but K2 is the grandmother point. But it is beautifully strengthening to the one particular organ, that organ to be known as a renal system. Whatever there is, K3 point is you are strengthening to the renal system. So renal system means, the Taiwan philosophy also says the same procedure, even the TCM procedure also same procedure, but you wanted to activate the renal system, the entire region of the ankle region. You remember that points to be known as a Tai Chi, Ta Chung, Che Chuan, Sao, I, Folio, Chu, Pin, Ingo. These are the entire region of the points, ankle region, where the females are using, children are using the anklets, especially the entire anklets region, the points to be known as the renal points and then vesical points, to strengthen the female hormones predominantly. The estrogen to be regulated, progesterones to be regulated, for the male testosterones to be regulated, androgens are regulated by activating that particular point. So therefore the kidney 3 point is majorly strengthening to the skeletal system and also the renal system, to strengthen any kind of the kidney malfunction is there, impairment of the kidney function, where the creatinine level is excess on that time, or the glomerular filtration rate is not happening. Even today I am treating to the some of the case studies which is connected to the kidney malfunction. I am maintaining for the last 2 to 3 years or the 5 years maximum, the people are undertaking only acupuncture related condition, how we need to maintain without going for the dialysis. But if the patient having the 1.5, 2, 3, 4, 5, 6, 7, 8, 9, till 9 I am treating to the patient to controlling the creatinine level, but still is not super simple. It's not possible to all the patients in one way, but drastically it elevates the creatinine level. EGFR will drastically will decrease, and also urea will get increased and potassium level get increased. So that time it is very much complication. But still I wanted to tell you, you need to strengthen the renal system. You can strengthen by activating the kidney 3 point is always is good to strengthen. At the same time, when the patient get problem, you remember the obesity also. When the excess obesity is there, chances are there to get some kind of the gastric related disorders, or the excessive heat is accumulated in the body, or the spleen metabolism is not good, the transportation is not good, transformation of the spleen is not good. Even that time there is the retention and accumulation inhibition is there. So that time you wanted to continue or proceed for the fluids to be proceed by the urethra. That time you wanted to use the K3 is advisable. By the way, K3 is good point to strengthen the back of the kidneys, to regulate the impotency, to regulate the good quality of the sperm, and also if the person having the oligospermia. Asthenospermia means absence of the sperm. Oligospermia means is the less sperm's quality is there, or maybe the tetrazoospermia, or the kind of the zero kind of the sperm. So that time it is really great difficult. Perhaps if possible evening I'll talk about if the azoospermia is there, what could be the reason, where the obstruction to be taken place, how to be regulated, that we will think over it. But however, you understand mild to moderate related problem having this condition, definitely this will be impact most of the diseases. Normally says by looking the porn films, they says that I got the impotency because I see the images, the both our couples are doing the intimacy coitus in the image I used to see in the laptop, but I don't get any erection. But bloody stupids, but that is something is different, but the touch and feeling sensation is different. But looking that and the patient is feeling that ayo, I don't have the erection, I don't get feeling at all, I don't get arousal, but I feel my low libido. But if I do masturbation, it won't get erect also. Even don't think that men itself is doing, or the boy itself, girls also does a mistake by putting the fingering. But all nonsense we're going to do that sometimes is not really good, right? If that is spoiled in that way, but this point will be certainly helpful to strengthen the frigidity of the female and also to get the libido by using the K3 point for the male as well. Both the male and then female, both the partners are required at the age of the greater than 45 years. You know that there is a 56 years maximum the chi is existing with the men, but after the 56 years the men certainly require the good amount of the energy if we activate, because after the 49 years menopause the woman required energy. That means indicating that you shouldn't do the coitus, no intimacy. Is not like that, but you are closed your earth passage, but now is not opening for the conceiving is implantation may not be taken place, that to be known as a earth passage get closes. But doing the coitus intimacy, but intercourse is possible at the age of 70 years also, men and then women. But later period after the 49 and 56, you wanted to increase the energy of the essence and also to increase the energy of the quality of the sexual life will be blissful. Then there is a harmony, there is a touch. That's the reason Hu Yin point, I think in one single point I have given the lecture for 20 minutes how there is a single point is connecting to the heaven, how the woman will get the blissful and happy feeling all the time, because husband is crorepati, but now the woman is very pathetic situation or the miserable life, the personal life is not happy. Then what is the in between? But you have the good enough amount, but you are not making the happy. Then again there is the misconception to be taken place. There is no harmony between the husband and wife. To become the harmony, this will be really helpful to treat for the doing the moxibustion and also doing the needling on that particular region will be great helpful to strengthen overall energy of the reproductive system and also to strengthen through the renal system. By the way, this will increases the what is required for the progesterone for the female to become the pregnancy, and also to become the person will get the testosterone, get excessiveness, he will get the stamina, androgens will get increases. So therefore using this particular point will be useful to treat for the various condition related to the disorders. By the way, the K3 is equivalent to the spleen 9 point. So therefore use the spleen 9 point or you can use the K3 point. Both the points are same function. Now let me see what particular time is advisable to use this point. But K3 is the what is the organ clock timings? 6 p.m. 6 p.m. already have the good energy. The person is very good energy he do have. But this is belongs to the grandmother point. That means mother point means strengthen the energy to the kidneys. Therefore, when kidneys require the energy, morning 6 a.m. is required the energy. Therefore, use the K3 point specifically in the morning 9 time. Ask them to the patient, activate this point in the morning 9 a.m. Sir, now ಎದ್ದೇಳೋದೆ 10 ಗಂಟೆಗೆ 6 ಗಂಟೆಗೆ ಹೇಳಿ ಸರ್ ಒತ್ತಡ ಕೊಡೋದು सर नो बट उठते हैं तो 10 बजे 9 बजे तो काम पे प्रेशर देंगे अरे बुद्धू उठो सुबह ही अप्लाई द pressure on this particular point on the K3 point is advisable to activate the K3 point is good. If it is not possible in the morning 6 a.m. then spleen timings is the 10 p.m. then 10 a.m. So 10 a.m. drain the energy because good amount of the energy in the spleen is there. Again says सर नाश्ता करते हैं तो 11-12 बजे तो स्प्लीन में एनर्जी कहाँ रहती है. अगेन वी डज ए मिस्टेक इंक्लूडिंग मी. Maybe Almighty should give the right pathway and right sense and then everybody. So what I express, but first give me that gratefulness to me, that will be spread to everyone, because I should be purified from. By the way, I have the breakfast at 8 o'clock by using the fruits normally with my children, and all of us will have the fruits at 8 o'clock, but we'll have the breakfast at 10 o'clock is not good sign, by the way. But 10 o'clock having the more time of the spleen, so that means whatever you had in the breakfast 8 o'clock, that passing to the spleen with for the transportation. But we are having the breakfast at 10 o'clock or 11 o'clock or 12 o'clock, but spleen also empty, but you cannot drive the energy, drain the energy from the spleen. By the way, that's called as a bioorganic energies existing, biorhythm energies existing, the natural energies existing, the cosmic energies existing in the spleen, because that is the natural time of the spleen. So that time 10 a.m. drain out the spleen 9 point, or you can use the K3 point on that time, or you can use the spleen 9 or K3 in the morning 6 a.m. also advisable to regulate for the overall health. Now the people are suffering for the knee pain and also for the back pain. That condition we wanted to strengthen the skeletal system, bone system. कहीं पे भी bone में दर्द हो, skeletal problem हो, anywhere in the finger problem, joint related problem, head related, spinal cord, that means vertebra related problem, the upper back, middle back, lower back, anywhere you have the problem, that you can use the point to be known as a K3 point is advisable. Also the patient having the excessive heat is there, and due to heat region he will get some kind of the pain. Even that condition also you can treat by using this specific point is advisable. At the same time, when the patient feel the coldness all the time and also pain is there, in the winter season he get the pain, so winter season is getting the pain, that indicating rather than K3, better you can use the K2 point is advisable. Better you can. So hopefully you understand that is the kidney 3 point is strengthening to the overall skeletal system.